Good morning and welcome everyone. I'm going to try and project here so everybody can hear me all right with the mask on. For those who don't know, my name is Joe Scopoli. I'm the president and CEO of the Guthrie Clinic, and it's my honor to be here with you this morning as we break ground on this exciting and much needed facility. That's not a good sign. There we go. Okay. So as we break ground on this very excited and much needed and anticipated facility, the Cortland Medical Center Cancer Center. I want to start by welcoming some special guests that have joined us today. Cortland Mayor Brian Tobin. Thank you. The President of Maynard Hoyt Corporation, Jeremy Thurston, down in the back there. And from Upstate University Radiation Oncology, Dr. Alexander Vanaskovich. Thank you. Okay. Since our affiliation with Cortland Regional Medical Center last year, we have been working hard to enhance the services and improve availability of critical clinical services here in this community. If you think about patients with a malignancy, they really don't want to travel. They want their family nearby. They want to be able to get their services, their medical care as close to home as possible. And so it was a natural fit for our organization to partner with the community, with Upstate, and with Guthrie's resources to bring a cancer center, a comprehensive cancer treatment center to this community. And we have done a lot of work over the last 2 years to strengthen all of the medical services that are available in the community. And this is really an important first step as we go forward with this. So I want to turn it over to Jen Yardom, president of the Cortland Medical Center, to talk to you a little bit more.
Thank you, Dr. Scopoletti. Hopefully everybody can hear me okay. When Guthrie and then Cortland Regional Medical Center formally became affiliated in January 2019, Guthrie committed to making significant investments in the medical center. For the past year and a half, we've had many people working tirelessly to bring that promise to life. So now, a year and a half later, Guthrie Cortland Medical Center is experiencing a number of exciting changes, of which is one of the many is our new cancer center. Having outgrown our current space within the hospital, the new center will provide comprehensive care for our patients all under one roof. I'd like to take a moment to recognize one important person in the process. Denise Wren, our Vice President of Finance and Chief Financial Officer, sitting in the back, has worked many years and has been involved from the very beginning in bringing consistency and commitment to the process. So thank you, Denise, for your commitment to the organization and this project. In addition to the new cancer center, we've made considerable investments in our medical imaging department in the recent past. We are in the process of installing a new CT scanner, which will not only service our cancer center, but all of our patients within the community. We've also added 2 echocardiograms and 3 ultrasound machines that are currently in use. This past weekend, I'm excited to announce that we went live with Epic, our new electronic medical record, new to Guthrie Cortland Medical Center, which brings us into the rest of the Guthrie Clinic system. It allows immediate access for our patients, and for information when and where they want it. It also provides a patient portal and online appointments and a multitude of features that is second to none, and it is one of the top EMRs in the country that we are proud to bring to the Cortland community. With a focus on patient safety and employee safety, we've also recently invested in a new security camera system, as well as temperature and humidity monitoring system. So as you can see, we've got a lot going on, and we're very excited to bring all of these new technologies to Guthrie Cortland Medical Center, and we're thrilled to be able to provide the community with the health care they deserve close to home. So now, to share more about our new cancer center, I'm pleased to introduce to you Dr. Thomas Gergel, who is our Chief of Radiation Oncology for the Guthrie Clinic.
So I am standing in today, albeit on one leg only, for Dr. Lowry, who was planning on being here this morning, but who at the last minute was unable to attend. Rest assured, I will almost certainly not be as loquacious as he likely would have been. And if you've ever received an email from Dr. Lowry, you know what I'm talking about. Nonetheless, his importance to making this day a reality cannot be understated. The ancient Greeks spoke of nostos, N-O-S-T-O-S, a concept encompassing the desire to return home and the importance of home in general. This was most evident in the epic poem The Odyssey by Homer, where our hero Odysseus spends 10 years trying to return home to, of all places, a small island in the Ionian Sea called Ithaca. That's Ithaca with a K, not a C. Guthrie's vision of providing excellent care locally, where people call home, is one of the reasons I returned to Guthrie over 3 years ago. This new cancer center will be critical to achieving Guthrie's goal of providing state-of-the-art medical oncology and radiation oncology services for cancer patients who call the Cortland area home. The new cancer treatment center will strengthen services by providing cancer care under one roof. Cancer patients will benefit from better access, convenience, upgraded technology, including a new linear accelerator, and coordinated services in one location. This $10.6 million facility will bring together radiation and medical oncology in one location with a new state-of-the-art linear accelerator and 10 chemotherapy infusion chairs. The new facility will offer additional treatment areas, an on-site pharmacy for preparing medications, phlebotomy draw stations, and private rooms for multidisciplinary services provided by dietitians and social workers. A key component is a unique radiation oncology partnership with our neighbor to the north, SUNY Upstate Medical Center. In that regard, I am pleased to see in the audience Dr. Bonishkevich from SUNY Upstate, who is presently the lead radiation oncologist in Cortland. And with that, I'd like to introduce Dr. Patrick Hayes, Guthrie Cortland Hospital Chief Medical Officer.
Thank you much. I'm pleased to be here representing the Cortland Cancer Treatment Center campaign team. Mr. Steve Sanquanti and I are co-chairpersons in the campaign to raise funds to support this center. Steve, thank you. Please recognize Steve. Why do we need a new cancer treatment center? Cancer is the leading cause of death in Cortland County. On an annual basis, there are over 700 new cancer patients in the Portland-Tompkins region. Lung cancers, breast cancers, GI cancers, and urologic cancers are among the most prevalent types. According to the medical center's tumor registry data, approximately 2/3 of cancers diagnosed in Cortland County residents are made here at the medical center. We know a number of patients decide to get their treatment elsewhere. They do not all receive care here. Currently, Guthrie Cortland Medical Center operates outpatient medical oncology and radiation oncology practices at separate locations. This new center will consolidate all oncology services under one roof with the latest technologies. The integration of services will be ideal for the patient, as it will provide comprehensive care while being more convenient. Common cancer treatments are time-consuming, treatment schedules can be long, and nowadays treatments can become lifelong endeavors. At our new center, frail and vulnerable cancer patients will no longer be burdened with notable travel times, frequently in inclement weather. Keeping our community healthy takes serious commitment. Now we reach out to our friends, to our neighbors, to physicians, staff, and patients to support this effort. Our Cancer Treatment Team Center campaign will help ensure that our local hospital continues to thrive, and that our local hospital will enhance our commitment to be there when you need us. Thank you. Dr. Stokoletti.
So I think it's time to put a shovel in the ground, so please join me as we break ground for our new $10.6 million cancer treatment center.